You're watching CTOM TV. Knowledge is power.
Any sort of cancer diagnosis, regardless of how how early you catch it or how late you catch it, tumor DNA sequencing and expression testing really are the latest diagnostic tools, and you want to get those regardless of where you're at. They're incredibly powerful tools that can help us decide what sort of drugs are going to be beneficial. And just to give you some brief numbers, you can have many different mutations in your DNA. Typical genes are about 100,000 base pairs of DNA. And even if you just have 150 base pairs of DNA, you can have more mutations in that 150 base pairs of DNA than there are atoms in the known universe. So this is why cancer is a unique disease for every single person, because every single mutation, we're going to have some common mutations, but we're also going to have mutations that are completely unique to us. And so it's really important to determine what mutations you have that make your case unique, so you can determine what drugs are going to work for you and what drugs are not going to work for you. The other thing too is knowledge is power. And if you want to get information on something, rather than spending a lot of time looking around, give us a call, book a PSO, a 1-hour consult, or you can get so much information. And the reason is there's probably about 300 different presentations every year, seminars every year internationally on cancer. There's going to be more, but those are the big ones. Out of those 300, some of them have a ton of information. So, for example,
the American papers. When you say
the American Association of Clinical Oncologists, known as ASCO, that's one of the bigger ones. There's also EMSO, which is a European version of ASCO. The ASCO can sometimes have 7,000 or 8,000 different presentations, not presentations, but what they call abstracts. That means papers published in the ASCO. And when you go for a seminar, when a doctor goes for a seminar for upgrading and they say, oh, yes, I went to ASCO, they may go and see 20 or 30, or they may look at, maybe 10 or 15 different presentations over a 3-day period or 4-day period of time. But, if there's 7,000 or 8,000, you need somebody that's going to go through all of those all the time. And that is our job. Our job is to know what everybody is doing in the world. So we're unbiased. Our information, we're not committed to any one company or any one treatment or anything. Our job is to know what everybody in the world is doing and say, this is better for you, this is better for you, this is best for you, and this is best for you. And you can get a lot of that information just from a simple 1-hour consultation. So, don't struggle with something, give us a call.
Thank you for watching CTOM TV. Subscribe below and stay informed.